So you've just been diagnosed with breast cancer, a scary moment. But what is ahead? Hello everyone, I'm Joe Basichia, along with Dr. Lori Timmerman. She's a breast surgeon at Virtua. Lots of hope ahead, and at Virtua, a whole team awaiting you. Explain that.
When patients come to the breast surgical office, we either have them with a new diagnosis of breast cancer or an abnormality in their mammogram. Once they have that abnormality, we set them up for a biopsy to see what their diagnosis is. We're just the surgical piece, but at Virtua, we have a whole team behind us. So once you have your diagnosis, you'll be plugged into the system and have access to a whole slew of resources. You get placed with our navigation system. We'll set you up with radiation oncology services. We have support groups that are available. We also have genetics, a whole genetics team that's available to help you as well. Just that diagnosis doesn't mean that that's the end-all be-all. We have, the whole treatment plan for you to really get you through this diagnosis and your treatment, and make sure that you feel supported and that you have all the resources that you need.
So this is far more than just the surgery that's ahead, because there's so much more to the patient, as well for the patient's family and loved ones. Is that a whole big overall picture?
Yes, correct. So we have treatment for families as well. So counseling can be set up for them also, because it's a very anxiety-producing diagnosis, not just for the patient, but for their loved ones as well.
We mentioned that about anxiety. We mentioned about there's sometimes a lot of fear, obviously, but there's a lot of hope. Tell us about what's going on right now, especially at Virtua.
We have early treatment options for breast cancer, and we've been doing increasing our screenings as well. And I think patients are much more aware of the benefits of getting screened early, so that we've been diagnosing, when we do have new diagnoses of cancer, they're at a much earlier stage and it's much more treatable.
So 10 years ago, it was a whole other time compared to even where we are today and the strides we're making.
Correct. So since we're screening so often, they're very aware of and taking control of their own screenings and diagnosis. When they come to us, many of our patients are very, very early stage, which is very, very treatable and has great outcomes.
Dr. Lori Timmerman, breast surgeon at Virtua, thank you for being with us.
Thank you for having me.
To learn more about Dr. Lori Timmerman or all of our physicians at Virtua, simply go to virtua.org.